I am choosing to go to a provider that is not in my network directory, not in network with my plan. But you have to figure out what's my out of network deductible? What are my out of network benefits? Am I willing to pay that price to see this provider?
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
Who spend their working days focused on health benefits and healthcare.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits system.
I'm Jolene Myers.
And I'm Sarah Flusky, and we're ready to lament,
Complain,
empathize, and maybe help a few people.
Today we're talking about what in-network really means and why it can make a big difference in what you pay. And I automatically just hear the Ramones. Should I stay or should I go? Come on. And if there were not copyright laws, you could insert that sound right here. But
Absolutely. And this is how we're going to help figure out if we should stay or if we should go. When you talk about what is in network versus out of network, we have to start with what a network is. So a network is an agreement with providers and facilities that outlines the allowed amounts a provider or facility will accept as payment. So it might be one thing with one network, might be different dollar amount with a different network. It's different for government products. It's different for products on the exchange. Those are different amounts because the providers have a different network arrangement with those network organizations. So national networks will include provider contracts across the United States, where you might have some regional, local networks that focus more on a limited geographical area. And they're not national plans. They're not intended to be national plans because the goal is to serve a very regional fixed audience. So some of these plans might offer an HMO or a narrower network of providers. So sometimes that saves people money when that provider network is limited. You might have what they call a narrow network option that isn't a big brand name that you recognize, but something that's a little bit more limited in scope, but will cost you less because there are fewer providers that are accepted in that network. So when you're looking at your options, the best start is who are you seeing now? Do you like them? And are they in the network option that is included in the plans you're evaluating?
and that's available in a provider directory, which is, typically on your health plan's website.
Yes, but the provider directory, in order to find out that somebody is terming from the network, the provider has to say, this provider in our group is terming. That has to be sent to all of the networks that provider participates in. Then the network has to go in and term the contract for that provider. Then the network directory will get updated. It is a good starting point. If you need like lock, stock, and barrel, call the provider's office. The network directory is a great guide. You might also say for a narrower network or to switch to this network that is less expensive for me to have the plan, I'd be willing to switch providers. Then it kind of opens up a different possibility for you. So if your provider is really important, call and verify. So if a provider or facility did not sign an agreement, that means that they have not agreed to certain standards that the network has for participation. Those providers are out of network. Where I live, I have a regional network, and UPMC in Pittsburgh is not in my regional network because it's not in my local geographical area. But if I decide to go there anyway, because I like what UPMC is doing and that's important to me, I am choosing to go to UPMC. If we're talking about, nobody locally does this thing or sees these people, different story. What we're talking about is there's a doctor in my area in network that can do this thing or see me for X, Y, and Z. UPMC is maybe well known for this, and so that's a place that I want to go. I am choosing to go to a provider that is not in my network directory, not in network with my plan. So now I'm going to pay at the out-of-network benefit level or an out-of-network price with the provider, so it's going to cost a little bit more. But you have to figure out what's my out-of-network deductible, if you have one. What are my out-of-network benefits? What do those look like? Am I willing to pay that price to see this provider?
So pause this episode on your car and go grab an EOB. What's an EOB? Explanation of benefits. So you go to a provider, you get a service. This is something that comes into your mailbox. It is not a bill. Usually says it right on there. A dermatologist in my network charged $165 for a visit. So my network agreement says they can only charge up to $145. So the billed amount gets adjusted to align with the network agreement. You can see this on your explanation of benefits. It's all laid out, typically, should be. Then you should see the amount covered by your insurance. So in my high deductible health plan, I see $0. In a standard copay, if your copay is $40, the amount covered by your insurance would be $105. We're starting the math here. If this dermatologist was not in my network and they charged $165 for me to walk into the office, I can be billed $165. So if I don't have out-of-network benefits, I'm going to owe $165. And the out-of-network spend doesn't count towards any out-of-pocket calculation. So if they have a deductible or if you have a deductible, this does not count.
Right. So if you have a $3,000 in-network deductible and you go to a provider that is not in network, it doesn't count towards your deductible on in-network benefits. You might also have a deductible on out-of-network benefits, and maybe instead of $3,000, that's $6,000. I'm just making easy math. It'll count towards that, the $165, but not towards your, in-network benefits. So you'll see that on the EOB, that like reduced rate. So you'll see the billed charges by the provider, then what the network is willing to accept. And then if you haven't spent all of your deductible, you'll see that the plan's going to pay $0 because you're fully responsible until the deductible is met, unless you've met the deductible or your plan doesn't have a deductible. And then you'll see that rate that the plan is contributing towards payment of the $145 for the in-network provider.
So look at your benefit grid. Yeah, check to see if you've got out-of-network benefits. I have out-of-network benefits that kick in after I hit my deductible. So I'd probably end up paying $165 for this dermatologist appointment. But if I hit my out-of-network deductible, I would pay 25% coinsurance. So it would cost $41.25. I did not do that math on the spot. Ish.
Yeah. Percents that was high school math, but I still do it the same way I did way back then. That's the only way to get it done. So if you're looking for an in-network provider, we talked about the online provider directories. Most, if not all, provider networks provide something online that you can use as a guide to identify those in-network providers. But really, gold standard is to call the office to check to see if the provider participates, because there's that kind of administrative gray space. So if I'm going to ABC Medical Group, they have a new primary care provider. I need a new primary care provider. I want to go see Dr. Smith. Dr. Smith is new. He's accepting patients. If Dr. Smith is new, ABC Medical Group has to go to every network that they have agreements with and say, please add Dr. Smith as an in-network provider for ABC Medical Group so you can go see him. If you see Dr. Smith in the gray space between when Dr. Smith joins the practice and Dr. Smith gets added to the regional or national or narrow network list of providers, they'll look like they aren't in network. So that individual, even within the group, ABC Medical Group is in my network. Those individual providers have to be in the network. It's this weird gray space, but the goal, I think, for you and I, Jolene, has been, how do we help people understand?
Yeah, and I don't think it's a shocker to anybody listening that within that gray space, a lot of these things are not happening in real time. Even though it's 2025 and we have robots helping us, there's still humans doing some work in the background. So sometimes there is a lapse. So I think that's a really great point to mention. So
Yeah,
good
it's
call.
not the providers not done their job, or that the network necessarily hasn't done their job. If you see the provider in the gray space, you're going to find out that the provider was billed as out of network. So then you might have something to deal with that you didn't want to deal with. So that's why the call the provider to verify is like the gold standard.
That's
So
it.
that's it. I think that's it for in-network, out-of-network today.
Yeah, we hope that you're feeling a little more confident checking network status next time you book an appointment. An in-network provider is going to save you money. It's worth it to call the provider to confirm they're in your network if you want to dot your I's and cross your T's. But if you're adamant about seeing an out-of-network provider, ask what the upfront charges are or could be. You can always ask if they have a discount for cash.
If you go in as a self-pay patient or if you're paying with your out-of-network benefits, it's really just a matter of awareness. It might be the place that you decide you want to go. If you go because it's not a sandwich board of signs, it's not like McDonald's and a hamburger is, $3.50 or like $5. How much are they?
It's
You don't get that. So you have to ask the question. And I think that's, you can feel confident about this is a provider I want to see. I recognize they're not a network. Ask the question up front for an estimate of those costs, just so you know. You know it's going to be billed out of network, but what is it going to cost me to be there? I think that's important. So next we'll take a look at what happens after the doctor visit and why bills are showing up.
Yep.
Sound good?
Yep.
Yeah. Thanks for joining us.
Thanks. This podcast is brought to you by Nova Healthcare Administrators.
Have a question or a situation you'd like advice about?
You can find us on X at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like or subscribe, but most importantly, share. We'll find the insiders.
You share it with the outsiders.